How accurate are flu tests? Imagine trying to catch a fleeting shadow in a busy street. That's similar to how flu tests work. Their accuracy depends on the type of test, timing, and how well the sample is collected. The most common tests are rapid influenza diagnostic tests, molecular assays like reverse transcription polymerase chain reaction, and viral culture. Rapid tests give quick results in about 15 to 30 minutes by detecting viral antigens. They are convenient but tend to miss some true cases, with sensitivity often around 50 to 70%. This means they can produce false negatives, especially if the viral load is low or the sample isn't collected properly. However, their specificity is usually above 90%, so positive results are generally reliable. False positives are less common but can happen, especially when flu activity is low in the community. Molecular tests, especially reverse transcription polymerase chain reaction tests, are considered the most accurate. They detect viral RNA and often have sensitivity and specificity exceeding 95%. These tests can identify the virus even at low levels and distinguish between different types and subtypes of influenza. The main downside is that they require specialized laboratory equipment and take longer, sometimes several hours or a day to return results. Viral culture is another method, which is very accurate but slow. It can take days to grow the virus in a lab, so it's mainly used for research or surveillance rather than routine diagnosis. Several factors influence how accurate these tests are. Testing early in the illness, within 3 to 4 days of symptom onset, increases accuracy because viral shedding is at its peak. Proper sample collection is crucial. A poorly collected nasal or throat swab can reduce the test's sensitivity. During peak flu season, when the virus is widespread, positive test results are more reliable. Outside of flu season, false positives may be more common because the virus is less prevalent. Clinicians often face the challenge of interpreting test results. Because rapid tests are less sensitive, a negative result doesn't always mean you don't have the flu, especially if symptoms are strong. Doctors may decide to treat based on symptoms and the local flu activity, even if the test is negative. During high flu activity, they might consider starting antiviral treatment without waiting for confirmatory tests. Surveillance data shows that during low activity periods, flu positivity rates in tested samples can be as low as less than 1%, but during peak weeks, it can rise above 30%. This fluctuation affects how we interpret test results and the overall picture of flu spread. Molecular testing dominates surveillance because of its high accuracy, while rapid tests are more common in clinics for quick decision-making. In summary, the accuracy of flu tests varies widely. Molecular assays like reverse transcription polymerase chain reaction are highly reliable and considered the best option for diagnosis. Rapid antigen tests are faster but less sensitive, so their results should be interpreted with caution. Understanding these differences helps both healthcare providers and patients make better decisions during flu season. Always consult a healthcare professional for personalized advice and proper diagnosis.